Hi, my name's Eric Woods. I'm a student nurse from Cedar Crest College, and I'll be talking about my nursing leadership, Nursing 335, clinical reflection video. So I'd just like to thank everyone for the opportunity to allow me to have these experiences and shadow the various community, inpatient, acute rehabilitation, whatever it may be. So thank you. All right, so the first learning objective from the course is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the multidimensional needs of individuals and groups within the local geographic area. So the first objective was met when I attended the NSNA convention and the NCLEX review in Salt Lake City from 4/3 to 4/5. So March 3rd, March 5th. So I met this objective by learning about the various ways to answer NCLEX questions, and I know that it does vary from state to state, and that was explicitly outlined during the NCLEX review. I also met this objective when I attended the SNA Down and Discuss from Good Shepherd, and they just went over various types of brain injuries, spinal cord injuries. And I also learned about the kids piece, SNA Down and Discuss, and they talked about the various psychosocial factors when handling and treating various types of mental illness. I also met this objective when I attended the Meals on Wheels delivery service because there was multidimensional needs within the local geographic area, and this was outlined when I talked to the two gentlemen that I was with, and they said that some people will actually not explicitly need the service from a financial standpoint, but they may need the service just because they pay for it, and they just don't feel like making a meal for that day, and others might actually need it because of financial reasons. They just don't have the resources. So, 2. Apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. So I met this objective in various ways. First, when I attended the nursing supervisory role at Lehigh Valley Hospital, Cedar Crest, I saw a couple of rapid responses on the units, and the nursing supervisor would just fill in with where she was needed. So not necessarily within patient care. However, she was just talking with, say, patient was having an adverse reaction from an opiate, and the nurse was giving Narcan to reverse respiratory depression. And this nursing supervisor was just talking to the patient's family. Her daughter was there at the time, and she was just telling her what was going on, what they're going to do, what possibly the plan of care could be. Obviously, not divulging information that the doctor may not recommend. However, she did calm the patient's family down, and she helped the patient's family within that regard. So I also met this during the nursing supervisory role, and namely in the process of decision making. And I know Sullivan talks about each certain step of decision making, and it's like evaluating every decision after the decision's made, coming to certain conclusions. And with this, I found that the staff was short in various units with certain nurses, and they had to shift certain float pool nurses around to help meet the needs of the census for that day. So I know this can happen anywhere, and yeah. So number 3, evaluate the effectiveness, of communication promoting the optimal health of patients and their families. So communication was a big factor in all of the clinical experiences that I had. This was met during my time shadowing the charge nurse at Country Meadows Bethlehem, and she was in the front of the unit. She was mainly doing paperwork during the day. However, I didn't witness someone falling, but I witnessed what happened after they fell, and this patient was just found on the floor, so they had to fill out the proper incident report, what led up to the fall, what could have happened, and what they would do after. So I believe the patient had vital signs taken every 15 minutes for about an hour, certain neurological assessments done, and this was supposedly done by the RN, obviously because they cannot delegate that to an LPN or LVN because it's an RN scope of practice. His vital signs were stable during the time that I was there, and he ended up going back to his room, and the charge nurse ended up trying to implement certain ways that they could prevent the falls from happening. So he had more focused care, and they had CNAs, techs, whatever it may be, and LPNs closer to his room for the time being. And that was just to monitor him closely and try to prevent further falls. Also met this objective when I was at the mom baby clinical rotation during my leadership day, and I evaluated nurses communicating with various doctors, nurse practitioners, midwives, whatever it may be, and communicating with the families about what was going on, if there was something going on with the baby, communicating that to the patient, whatever it may be. So, number 4, critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So I met this objective actually when I attended a school board meeting at East Penn School District, and I found out that they were having trouble with psychological issues and mental illness. So I'm sure with everything going on that we hear about in schools, the public eye, school shootings, whatever it may be, there's actually a shortage of psychologists for the school, and they couldn't meet the recommendations for the research that they found. And certain school board members found that they think they should have had less psychologists per patient or student capita, and others found that they should have more psychologists per student. My personal opinion, I think they needed more, and I know I talked about this with Dr. Roberts, saying that I think it was 400 students per one psychologist, which in my opinion is outrageous, but it's just my personal opinion. Yeah, they just needed to appropriately cover for each school, and they just couldn't find psychologists to do it. So, number 5, apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. So I met this objective various ways once again. When first I listened to Donna discuss through SNA about a Good Shepherd registered nurse talk about how they advocate for the patients on a daily basis, and this was during the traumatic brain injury lecture, and how the families might not think about, like during a stroke, where the expressive and receptive, not dysphagia, but expression and receptive communication. So they had to advocate for the patients, just explaining to the family what was going on, that they're still there, even though they might not seem like they're all the way there mentally, that they're still just processing things maybe at a slower rate, and they just had to explain that to the families. And according to ATI, it is imperative for nurses to advocate for the patients on a daily basis. And that was just directly from the text in the ATI leadership book. I also met this objective during my patient logistics experience, when I learned about organ donation and what happens if there's a death in the hospital, how quickly, I think it was Gift of Life, the gentleman mentioned, how quickly they can come and harvest the organs, for lack of a better term, and the process for the procedure. So, number 6, formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. So I mainly met this objective when I observed a nurse anesthetist at the Lehigh Valley Hospital, Cedar Crest. Her name was Stephanie Williams. It was actually my favorite clinical, and it solidified what I wanted to do with my future and become a nurse anesthetist. So they have probably the most independence in the nursing field that I've seen so far, and the fact that they can delegate certain things. They have to make critical decisions on their own within a certain period of time, or else the patient might actually die. She talked about whatever she had to do for continuing education and what classes she had to take, and when she had to call an anesthesiologist, and the fact that the anesthesiologist might be present for intubation, and the anesthesiologist might push certain meds at the start of the procedure. However, the nurse anesthetist has all of the same medications on hand, and they can use it whenever they need to. So I thought that was a really cool experience, and that was my favorite. So, number 7, recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. So, I met this objective during the National Student Nurse Association Conference in Salt Lake City. I attended the nurse licensure lecture where a nurse discussed policymaking in each state and the difference between each state and just licensure within each state, like policymaking as far as nurse to patient ratios, certain medications. There's various examples. So the last but not least, student learning objective: predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So I met this in various ways once again, but I'm going to talk about the clinical experience that I had at Sacred Heart Hospital for my leadership day during a mental health clinical. I just noticed the ethical dilemmas surrounding a particular patient who had a drug problem, and they couldn't quite find a place for him to go to at the time because he had run out of his time at Sacred Heart, but they were trying to find more of a long-term rehab program for him to go to because he had various diagnoses: schizophrenia, depression, manic bipolar. He had almost everything under the sun, for lack of a better term. So I found that talking with him and being therapeutic with him was the best thing for him, and just talking about why and how he used drugs, how it affected him, and just better ways to cope. So potential ethical dilemmas. I also attended an SNA Down and Discuss from the coordinator of the nurse anesthetist program, Dr. Woodruff, and she talked about how 20% of nurse anesthetists will have a drug problem, which I found astounding. And that makes sense, though, because they have such an access to various drugs, like painkillers, morphine, fentanyl, whatever it may be. I just found that extremely interesting. So, want to thank you for everything, and have a good one.